Welcome to the MDS Leadership Spotlight Series, an initiative of the Women in Movement Disorders Special Interest Group of the International Parkinson and Movement Disorder Society. In this series, we interview remarkable women who have excellent achievements in the field of movement disorders and as leaders. I am Divyani Garg from India, and in today's episode, I am thrilled to welcome Professor Ruey-Meei Wu. Dr. Ruey-Meei Wu is a professor at National Taiwan University's College of Medicine and director of the Center of Excellence in Parkinson's Disease and Movement Disorders at National Taiwan University Hospital. She has been on the executive committee of the International Parkinson's Disease and Movement Disorder Society from 2019 to 23 and has also previously chaired the Department of Neurology at NTU and NTUH. She was the president of the Asian and Oceanian section of the Movement Disorder Society from 2011 to 13. And she has founded and currently presides over the Parkinson Alliance of Taiwan. Professor Wu has received the prestigious Yoshikuni Mizuno Lectureship Award in 2019 and the President's Distinguished Service Award in 2024 from the International Parkinson Disease and Movement Disorder Society. Her research is focused on clinical genetics, cognition, and pathophysiology of Parkinson's disease and atypical Parkinsonism like multiple system atrophy. She has published over 180 papers and is an associate editor of Frontiers Neurology Journal. Dr. Wu, thank you for being able to be available for this interview and a very warm welcome to you.
Hi, thank you, Dr. Gaga, for your very comprehensive introduction. It's my honor to have the interview talking about my own career and some opinion that may be helpful to the MDS members, particularly the women members, to develop your own career. So we started the first question, or you want to start the question to me?
Yes, of course. So the first question that I would like to ask you is that we have seen a glimpse of all the achievements that you've had in the field. Can you walk us through the highlights of your career?
Actually, when I was young, the subspecialty training in Parkinson's disease and movement disorder was not available in Taiwan. But due to my interest in neuroscience research, particularly neurotransmitter-related disorders, I chose Parkinson's disease as my subspecialty and pursued 2 years of neuroscience training on animal study of MPTP Parkinsonism at the National Health Institute in the United States from 1992 to 1994. And I acquired the knowledge and skills for treating Parkinson's disease through clinical practice, reading journals, visiting the MDS website with various educational materials, and attending the International Congress of MDS and the neuroscience meetings as well. This August marks my 30th year as a faculty member at the National Taiwan University, and my academic journey in neurology as a movement disorder specialist has been extensive. And at the moment during the residency training and attending the first MDS Congress in Rome, in fact, remain memorable and still very alive in the brain.
Yes, thank you for sharing with us your experience. What has been your experience as a woman in this field, particularly as a leader?
Women generally face multiple challenges in their pursuit of leadership roles, including such as gender bias, work-life balance, and representation barriers. Encounter gender bias in the professional career. However, I'm very lucky because the gender discrimination is less prevalent in Taiwan, and I have not encountered the gender bias in my professional career. On the contrary, I think certain characteristics often attributed to women that we can contribute to effective leadership. Firstly, women often adopt a softer and more empathetic approach compared to women, to men. So as a female leader, I view my team as a family and take pride in recognizing the achievement of every member. I dedicate time to clearly define the role for my colleagues and fostering an environment of trust where they feel comfortable sharing their thoughts, challenges, or even mistakes. This approach enables us to attract residents to join the movement disorder group in my department and participate in research initiatives. For example, as I remember a couple years ago when the new research assistants made an error by sending a DNA sequence without evaluating the primary sequence, then resulted in failed data. I encouraged him learning from the mistake, and subsequently he dedicated himself to laboratory work and also successfully completed numerous projects. We even worked together until the midnight to reach the deadline of like the research grant submission. So I think this is the strength as a woman leadership. And the second point is, as a neurologist and Parkinson specialist, I think maintain a positive outlook is essential to managing neurological disability in patients and motivating ourselves in research to advance our understanding of complex disorder and the potential cure through neurologists. Particularly, I think a patient with Parkinson disease, they have a long journey. So we always should appreciate their breath and also their breath, and also to encourage them to copy with this disorder. In April 11, that is World Parkinson Day. We celebrated this day in a famous Taipei, in a famous park in Taipei. So we emphasize our patient on some special design to encourage them to have exercise and also to use their brain to prevent the decline of the cognition and also their physical capability. So I think I encourage them and also appreciate say our respect to their breath in this very long journey. And then I think establishing a relationship with other leaders in the field is crucial for career advancement. I actively engaged in academic activities within the Movement Disorder Society and contributed to the formation of MDS Asia-Australia session. So interacting with experts enhanced my confidence, knowledge, and the reliance during the learning process. I'm fortunate to have many role models, particularly the women movement disorder specialists in the MDS Society in Western countries when very early years that did not have the MDS ALS session. So to establish relationship and participate in the special group are very important. Finally, in conclusion, I think empathy toward the minds and emotion of colleagues and the patient is a fundamental characteristic of successful leadership for a woman neurologist. Yeah, that's my
Thank
own.
you so much. That was very
my opinion.
That was very wonderful. Thank you so much, Professor Wu, for sharing that. A lot of us struggle with maintaining a work-life balance when we're working in this field. What have been some of your tips or tricks to kind of maintain a work-life balance?
Yeah, maintain a work-life balance can be particularly challenging for women physicians, especially when it comes to handling the demands of a medical career with the responsibility of raising children, especially in the Asian society. And balancing work and family responsibility can be difficult, especially as one progresses through our own career and family roles. Additionally, caring for elderly parents or other family members adds to the complexity of maintaining this balance. Why I say this point? Because like me, because in my family, I'm the only medical doctor. So when my parents were getting older or other family members suffer from disorder, then we take more responsibility for making decision for the care of their physical health. And the following tips, I think, may help in achieving a work-life balance. First, I think it's important to prioritize and organize your work. Using a planner to prioritize tasks, both professional and personal, can help manage time efficiently each day and allowing flexibility for unexpected events. So every day before I sleep, I think of the process of the event and check my calendar, what will happen, what the things that I'm going to do tomorrow, and what the work that I have to finish this week. So I think to prioritize and organize your planner of the work are very important and most important. And the second is to learn to say no. I think in every advice of the book have say about this point. Because as a physician, so we have a more request or more higher standard to our own self. So being selective about commitment at work and home can prevent overextension of the work. So it is important to adjust schedule before committing to any additional responsibility and to decline extra tasks if they interfere with personal time too much. This point is very important, but up to now, I still to learn this point and try to balance how extend of the commitment in my everyday life. And the third point is to set a boundary. So following the above point, I think clearly communicating work hours and the family time boundary to our colleagues and also patients can ensure that personal time is respected. Finally, try to listen to your own needs. So engaging in activity that promote relaxation and happiness for my own experience. Like I like to listen music. So listening to music, jogging, shopping, or visiting the countryside can all help in recharge and maintain the well-being of myself. For example, now it's spring is coming, then and the Mother Days is coming, so there are discounts in the department in the mall. So when I buy some new clothes for myself and dressing beautiful, then make me feel happy. Yeah, so that's a very simple, a very simple daily activity, and but that can inspire my spirit to continue the work. So So I think the above point will support the women physicians in managing our own professional and personal life effectively.
Thank you so much. That was very beautiful advice. And that brings me to my last question, which is, what was your biggest piece of advice for women who are pursuing a career in movement disorders and maybe even looking forward to being leaders in this field?
Yeah, I think movement disorder are very interesting group of disorder in the field of neurology. So it's incredible, rewarding, but also challenging. My biggest piece of advice for women entering this field um, could be to find and foster a supportive network first. So here I like to raise some key points to you for considering. First, to build a relationships. Networking is crucial. For example, you seek mentors and colleagues who specialize in movement disorder, such as finding a good center for movement disorder specialist training. The MDS also provides a fund for fellowship training in the Asia-Oceanic region. And this community can provide guidance and share valuable experience and offer opportunities for collaboration. And second, to stay informed. This means Parkinson's disease and related movement disorder encompass a rapidly evolving field, particularly in the pathogenesis, etiology, and the new drug discovery. So regularly engage with the latest research, attending conference, and participate in workshop to stay current on advancement and treat approaches. There are several education activity and website in every region, like in our LS region. Every month, we have different topics and organized by different institute in different country. So that's a very, very good resources to keep you stay informed in the updated knowledge in Parkinson's disease and movement disorders. The third, you have to get involved, like to join professional organizations that focus on movement disorders. So be involved in advocacy that can help you connect with others and who are enthusiastic about the field, while also enhancing your professional profile. So actively participate in, so I think you can actively participate in task forces or subgroups related to your research in MDS, and that can enrich your career and also extend your relationship with the other experts that are interested in your field. And finally, to embrace challenges. Approach challenges with reliance and confidence. That's a very important. I like to say the life is not a straight line, but it's like many complicated line mixed together. So it's not a perfect circle. So, so when we face the frustration, challenge, then we have to keep confidence to ourselves and think of the goal you like to reach. As a woman movement disorder specialist, to remember that our perspective can contribute significant value to the field of the movement disorder society and also the women medicine. Yeah, so that's my my thought about some advice for you to purchasing a movement disorder career.
Thank you so much, Professor Wu, for your valuable insights, for sharing your wisdom, and thank you for taking out time to meet with me today. Thank you.
Thank you. Thank you for your interview.